Our topic is acupuncture, because in a world where people are increasingly looking to treat their illnesses and discomfort in a natural way, acupuncture is once again gaining visibility around the world. Can change to the next slide. So in acupuncture, thin needles are inserted into key areas of the body to stimulate energy flow and promote healing. Acupuncture was an ancient practice that started in China 3,000 years ago. And the Yellow Emperor's Classic of Internal Medicine was the first document that talked about acupuncture. It was probably a collection of customs that have been passed down over years. The 12 major meridians are where this QI travels throughout the body. QI can also be called Qi, pronounced Qi. And the primary bodily organs and systems are represented by these meridians. However, these meridians, they do not precisely follow the blood or nerve paths. Studies suggest that acupuncture can aid in the treatment of migraine, low back pain, neck pain, osteoarthritis, knee pain and nausea, and among other things. Can change. Thank you. In all Canadian provinces and territories, medical practitioners and dentists are allowed to practice acupuncture. And to become an acupuncturist in Ontario, it takes from 2 to 5 years. You have to complete the TCM education, which means Traditional Chinese Medicine Education. It's a full-time post-secondary program, and clinical experience is required as well. The person has to do the Pan-Canadian examinations that happen every April and October of every year. Also complete and pass the safety program and jurisprudence course, register with the CTMPAO, and then the college reviews the application and the person becomes registered by the college. Also, physiotherapists and chiropractors can perform acupuncture, with exceptions in some provinces. Can change. Thank you. In regards to legal, acupuncture is a regulated healthcare profession in Canada. Continuing education requirements are there to maintain license or registration. And in regards to safety, acupuncture is considered safe, but there might be risks and adverse effects such as minor bleeding, discomfort at the needle insertion site, infection, nerve damage, and it just happens as with any medical procedure. In regards to ethics, informed consent is always needed, and issues related to cultural competency may arise, especially when working with patients from diverse cultural backgrounds. So it's very important for acupuncturists to be respectful of cultural differences in the healthcare practice.
So if we want to talk about the advantages of acupuncture, first we need to mention the natural approach, because acupuncture is a natural method that involves inserting thin needles into specific points on the body to promote healing naturally. It's a gentle and organic method of healthcare that does not depend on medications or invasive procedures. The next advantage would be the versatile treatment. Acupuncture has been used to address a wide range of health conditions such as pain, headaches, anxiety, and digestive issues. Also, personalized treatment. Each acupuncture treatment is customized specifically to the client's unique symptoms and health conditions. Minimal side effects. Acupuncture is generally considered safe when done by a licensed acupuncturist. The most common side effects will resolve quickly after the treatment, such as minor bruising or bleeding at the needle insertion sites. Next slide, please. Like everything else, there are some disadvantages to acupuncture also. The first one would be the lack of scientific evidence. The scientific evidence supporting its effectiveness is mixed with positive and negative results. So it's understandable if some people may question if it really works. The next disadvantage is that part of the benefit of acupuncture is actually in your head. Some scientists suggest that if someone believes in the treatment and has positive expectations, they may experience improvement in their symptoms, even if the actual source of the pain has not been eliminated. There's also risk of complications. If it's performed by someone that's not trained properly or is not licensed, it can cause nerve and organ damage and is more harmful than being beneficial. It's also time and cost. It's time consuming and costly. It usually requires multiple sessions to see the expected results, and it might not be covered by insurance. So making acupuncture a time consuming and expensive treatment. Next slide, please. So for the ADPI in a dental hygiene process of care, we start with assessment. The dental hygienist first should check client intra and extraorally, ask about any issues they're dealing with. And if client mentions stuff like anxiety, pain, or other concerns, they might suggest acupuncture as an add-on to help client out. The next step is diagnosis based on what the dental hygienist finds during the assessment. They will figure out what's going on. If client got things like jaw pain, dry mouth, or dental anxiety, they will take note of those and consider acupuncture as part of the diagnosis. They will tell client about the possible benefits of acupuncture for those issues. For planning, the dental hygienist puts together a treatment plan to address clients' dental issues and make them feel better. If acupuncture seems like a good fit, they will include it as an extra treatment option. They will give clients info on how it works and refer them to a licensed acupuncturist. When it's implemented time, it's go time. The dental hygienist sets things in motion by giving the client the info and referral they need to go see an acupuncturist. They will work with the acupuncturist to make sure they know what's going on with client and what they are aiming for with the treatment. The last step would be the evaluation. After the client had their acupuncture session, the dental hygienist checks in to see how things went. They will ask about any changes client might have noticed, like less pain, feeling more relaxed, or relief from other symptoms. This helps dental hygienists to see if acupuncture was actually helpful and guides for future treatment options. Now, Miriam will continue with human needs. Thank you.
Thank you, Mona. As we all know, the dental hygienist plays an important role in identifying the unmet needs during the dental hygiene process of care and can be a source of guidance for the client and also motivation for the client. He can provide education, assist in disease prevention, and also refer clients to therapeutic measures. So, some of the ways through which the assessments can be made is via the verbal and non-verbal behavior of the client, evaluation of face and oral cavity, radiographic findings, and clinical findings. Some of the unmet human needs of the client would be freedom from fear and stress. The client would be having some sort of anxiety and fear, or maybe feeling stressful about the cost, might be having white coat syndrome, might be scared of the cross infection in the clinic, or might be worried about the radiation exposure. Similarly, previous negative dental treatment experiences might be a cause of fear and stress for the client. Another unmet need is the freedom from pain. Many kind of pathologies and problems can be a source of pain for the client, and we would be suggesting acupuncture for that. For example, temporomandibular joint pain, TMJ, temporomandibular disorder, TMJ clicking, chronic muscle pain, atypical facial pain, neuralgias, nerve pains, especially trigeminal neuralgia, neuropathic pain, paresthesia or anesthesia of the oral and paraoral structures. Similarly, the other unmet needs would be the skin and mucous membrane integrity of the head and neck. Burning mouth syndrome has been found from through the research, and it was found that acupuncture has been really effective in trying to eradicate burning mouth syndrome in clients, whereby there is intraoral burning or dysesthesia, and there is no clinically evident cause for the causative lesions in the mouth. And similarly, xerostomia has been treated through acupuncture. Similarly, client might be feeling that he might not be satisfied with his wholesome facial image. That is another unmet need due to TMJ clicking sound, or there is halitosis due to xerostomia. So these were some of the unmet needs that can be identified by the dental hygienist. Now, the care plan, the hygienist will be identifying the possible etiology of the unmet needs and involve the client to establish goals. And in the interventions, he or she will be mentioning the referral letter, which has to be provided to the client for seeing the acupuncturist, highlighting the areas of concern of the client and the chief complaints. And in the ROT, we are mentioning the date of the referral letter, whether the client received the acupuncture treatment, and whether there were changes observed after the acupuncture treatment. Because sometimes for the clients, the conventional treatment modalities are not effective, and acupuncture provides new hope for client with such disorders. Now my colleague Bhavita will be carrying on.
Yep, thank you, Miriam. So some resources that we can offer to client are, the first one is pamphlet. They're also available online, and it costs about $22 a pack of 50. This way client get more information in depth, and we can place this at reception area or an operatory room. This way, while client is waiting for their appointment, they can also read and kill some time with that. Next slide, please. And second resources we can offer is support group. So there is a support group that's based on a community. It's called Toronto Community Acupuncture. It's hands-on, so they do offer a trial or experience that client can go in and ask more information. They can try it out, and they also have a bunch of review work. Well, there's some testimony that it helps with their patient, so they can also do that. And next slide, please. And the third resources we can offer is web-based. So internet, we can offer links, and we can also offer acupuncture website that we have in Canada as well. This way clients, younger clients, is more convenient. This way they can have they can read it on their own time, and it will help them understand more in depth, and it's easy and convenient to access. And the activity that we can do in classes that we're gonna do 3 points. When given pressure, it can relieve stress. So the first pressure point that we're gonna do is pericardium 6. So it's placed 3 fingers below the wrist, in between the 2 tendons, also known as the yin tang. We're gonna give pressure, and then we'll see if it relieves some pressure. And also we're gonna do yin tang. It's called the third eye. It's located between 2 eyebrows, the center of the eyebrows. And the third location that we're gonna do is RAN 17. It's located in the middle of the sternum, in between the chest and measure. It's 3 fingers, apply pressure, but we're gonna hold them gently about 3 minutes, and we're gonna give them pressure, and we can repeat this circuit as many as possible. So this will help us relieve pressure and stress also. So we can do that in class. Next slide. These are our references, and thank you.